The Nightingale Awards is a statewide event. It really is designed to recognize nurses, nurses at, not just at the bedside, nurses in any area, whether it be administration, at the bedside, offices, anywhere a nurse might practice. And it truly is a very special event. Here, we're very fortunate that we can send 8 of our nurses to this event. And every year in April, we actually ask the nursing staff and others, we ask physicians, any staff at ECHN who interacts with nurses to please nominate a nurse. And we get about 30 nominations back, which is great. So once we get the nominations back, we actually use previous year's nominees to make the final selection of the 8 that we're going to send. And so this year, that committee selected these 8 nurses, and you're going to get to meet 2 of them. The first is Sarah Agarwal, and she actually works in PACU. She's always got a smile on her face. She just loves her patients. She loves the department that she works in. And not only does she work in PACU, but she also does some supervision. So the entire hospital knows her, and they'll just tell you she is one of the best. You know, she's always calm, she's always professional, and she always treats not only the patient, but everyone she encounters with the utmost respect. Our second Nightingale that you'll get to meet is Jill Gilletti, and she works in behavioral health. And behavioral health is a challenge in and of itself, and those patients really have some special needs. And Jill approaches them very matter-of-fact, in a loving, caring way, but she makes sure that there are boundaries set and that they know what the expectations are. Her peers will tell you that she's a fantastic individual and someone who really cares about her patients each and every day. So that's really what Nightingale is all about, and we are very proud of all 8 of our nurses, and I'm very happy that you're going to get to meet 2 of them.
My name is Sarah Agarwal. I've been a nurse at ECHN for 2 years now in the PACU, the post-anesthesia care unit, and I'm actually starting in the NICU as well at Manchester. And I got into nursing mostly because I feel like there's endless possibilities in nursing. You have so many choices. You're not just a nurse. You can go into med-surg or critical care, which is what I like, or hospice, or you can even be a travel nurse. You can travel all over the country, even overseas. It just seemed like it was a really exciting opportunity, and it opened up a lot of options when you become a nurse. You can really go anywhere in the country and find a job that you love doing, which I think is unique to our profession. And when I got the Nightingale Award, I was incredibly honored and a little shocked, but to me it means that the dedication I have to nursing and to my profession and to caring for my patients and giving them good care was recognized, not just by my patients, who I do think recognize that we do a good job for them, but also by my peers. It's always nice to be recognized by your colleagues, that they appreciate what you're doing and they understand the work that you're putting into caring for your patients and into elevating the profession of nursing so that patients know how much we do. It's a lot of behind-the-scenes work as a nurse, a lot of continuing education to keep up with our skills, and we do a lot with the families, you know, behind the scenes. So I think that it's nice to be recognized for the work that you're doing. I think with ECHN, what I really love about it is that it's smaller. I came from a bigger hospital before I came here, and you really only knew the people that you worked with immediately in your unit. And it's nice that when you're transferring patients from unit to unit, you know the nurses you're giving report to, and they know you, and it makes everything go so much smoother when everybody kind of knows everybody, and it feels more like a family atmosphere. You see someone out on the street, and you know them, and you stop and chat, and it's a much nicer atmosphere to feel like you're part of a little community as opposed to just one little piece, in a big, huge, hospital machine.
My name is Jill Gilletti. I'm a nurse at Manchester Memorial Hospital on our adult behavioral health unit. I've been here for 7 years. I got into nursing because I felt it was the perfect balance between my love of science and my need to be of service, to be around people. So I felt that it was a perfect art form for me. Working at ECHN has really helped me fulfill my professional goals. They've given me many opportunities. I had the opportunity to become a physical and psychological management training instructor, which is really important to behavioral health. So I teach our staff and security staff, emergency room personnel, ICU staff about how to deal with agitated people and how to help de-escalate and manage those behaviors safely. I've also had the opportunity to get my certification in my specialty. So they've given me the time and the support and the opportunity to go and pursue all of those certifications that I've wanted, and really seen that it's had a benefit for not only myself, but for our colleagues here at ECHN. Receiving the Nightingale Award was definitely a huge honor. I think that nurses, we really do this because this is what we love. So it's really a privilege to be involved with your patients, and to be an advocate for them is really what I live for. And to actually be recognized by your peers and to be recognized by ECHN and your management, everything, I think was just so great. And you don't expect it. You don't do this for the recognition. You do it because you love your patients and you love to be of service. So to really have that earned success for me was just the icing on the cake. I thought it was fantastic. And to be a part of the Nightingale family now, to see all my peers and colleagues and what wonderful stories they have and just the compassion that follows nursing, it's so touching. And I think it's really wonderful to be a part of that. It's just such an honor.